So welcome everybody. Thank you for joining us. We'll be starting in a few minutes. Just want to let people know that this meeting is being recorded and we will have two sign language interpreters, Mary Catherine Hess and Andrea Ray. You can see Mary Catherine signing right now, and she will be switching with Andrea every 15 or 20 minutes or so. Okay, so welcome again. This is the sixth discussion in a series of panels called The Faces of Global Health, hosted by the Task Force for Global Health, specifically the CODE group, which stands for the Council for Opportunity, Diversity, and Equity. CODE's mission is to become a role model in our local and global communities by being actively engaged in equity efforts in those communities and to help achieve equity in our organization and community through education, and public health. For those of you who are not familiar with the Task Force for Global Health and the work we do, we are a nonprofit organization that works in over 150 countries, helping to advance health equity so that people can achieve their full potential. So in honor of National Disability Employment Awareness Month, which was this past October, and International Day of Persons with Disabilities, which is December 3rd, we are having this panel discussion. Okay, I just want to make sure everybody can hear me okay. So my name is Kim Kaportz. I know many of you. I used to work at the Task Force for Global Health for about 20 years. I started my career as a Peace Corps volunteer in Ghana. And after receiving my Master in Public Health at Tulane University, I consulted with several NGOs in Ghana and in the United States, including the Carter Center and the Task Force for Global Health. I joined the Task Force for Global Health in 2000 as the project coordinator for the Malaround Donation Program. And then I also worked for the Poliovirus Laboratory Containment Project, the Public Health Informatics Institute, Children Without Worms. And I also took, while at the task force, I took advantage of the Courtesy Scholarship and got my master's in business administration and my Doctor of Science pretty much for free. I left the task force in 2017 and I joined the CDC Foundation where I now work. So while we're still waiting for other individuals to join, maybe folks can just take a few minutes to put in the chat, where you're from and your name. Okay, Sarah from Oregon. Jasmine, hello, Jasmine. Okay, so they're coming in rather quickly. Let me turn on the chat. Amy Richards, Allie, Anita, Letitia, lots of people from the task force. Bill Nichols, hello, Bill. Hello, Shanti, good to see you. Carolyn, lots of new names. And someone just said they followed in my footsteps, Tulane. Okay, Laura, that's great. Amanda. Okay, thanks everybody for sharing, and sorry if I missed some of the names. Oh, Alan, hi, Alan. Okay, thank you for sharing. And yes, Shuman and I have something in common. We were both Peace Corps volunteers in Ghana. Okay, so now it is my honor to introduce our featured guests for today's panel. So just want to remind the panelists to turn on their camera as I introduce them. The first is Cassandra Holloway. Cassandra worked for the International Trachoma Initiative and is the project manager for the Neglected Tropical Diseases Supply Chain Forum. The Neglected Tropical Diseases Supply Chain Forum is a unique public-private partnership that includes some of the world's leading experts in pharmaceutical supply chain systems for donated drugs. Cassandra promotes collaboration among partners such as the World Health Organization, the donors, and implementing partners to ensure that the medicines make the many miles from their point of manufacture to endemic countries and eventually to communities that need them. We all know how hard that last mile is. She holds a Bachelor of Science in Environmental Health from East Tennessee State University and a Master's of Business Administration from Georgia State University. So welcome, Cassandra. Next, we have Steve Eichner. Steve Eichner has worked for the Texas Department of State and Health Services for over 10 years, helping plan and implement health information technology projects that improve the department's ability to make data-informed decisions. Steve has participated in numerous task forces and work groups to improve healthcare providers' ability to use their electronic health record systems to exchange data with government managed systems, including immunization information systems, laboratory services, and syndromic surveillance. Finally, we have Steve Serling. Steve Serling, prior to joining MAP International, Steve held executive level positions with nonprofits, including Child Fund International, Heifer International, Child Help, and World Vision US. He's also worked for several corporations, including Bristol Myers Squibb, Conagra Foods, Ameritrade, and Universal Life Sciences. In 2014, Steve was approached by MAP International. Because MAP is a Christian organization, Steve saw this as an opportunity to live out his faith through his work. He has dedicated his life to bringing critically needed medicines and health supplies to some of the world's poorest people so that no child suffers the same fate that he did simply because of lack of access to medicine. So thank you, panelists, and welcome. Before I start the conversation, I just want to say make a few comments to the audience. This is the first time that many of us have shared our stories regarding disabilities. So we may become a little bit emotional and it may take us some time to answer the questions. So we just ask you to be a little bit patient with us. Okay. So just to get to know us a little bit better, maybe we want to talk a little bit about how we came to public health. We come to our careers in public health in many different ways and for different reasons. So I want to ask Cassandra and Steve Serling how they came to public health. For example, I came to public health through Peace Corps. So Cassandra, do you want to share how you came to public health?
Well, as many people know, at the task force, I spent my early career in the commercial real estate. While I enjoyed my job, it was never truly satisfying as we kind of focused only on the businessmen getting richer. So in 2011, I pivot and I came to the task force for global health, where I took on the fight against intestinal worms in children with Kim reports, mind you. And we began helping millions of children. Next, I moved to the NTD Supply Chain Forum. At the NTD Supply Chain Forum, I had an additional 3 diseases brought to my plate. And now I can say that I treat millions, if not billions, of individuals. And who could say that? So this has been the most satisfying job I've ever had. And I've never looked back since I've left commercial real estate. Thank you.
Thanks, Cassandra. And Steve Serling?
Well, thank you, Kim, and welcome everyone. I came to public health actually through MAP International about 8 years ago. I started my career at Johnson & Johnson, Bristol Myers Squibb, American-owned products. So it's OTC pharmaceuticals. And then after about 18 years, went to the nonprofit space, World Vision. My last nonprofit prior to MAP International was was Child Fund, where I was COO. And so when I got a call from the recruiter about MAP, and I jokingly said, MAP, who uses MAP? Everybody has GPS. And they said, no, MAP stands for Medical Assistance Program. Now we go by Medicines for the World. And when I realized the impact of medicines have, and those of you don't know me, I had polio as a child growing up in South Korea. And had I had the vaccine, I would not have had polio. So I know the value and the importance of medicines around the world. The WHO estimates there are 2 billion people in the world that then have access to simple medicines such as antibiotics and for chronic diseases like hypertension, cardiovascular, diabetes, and whatnot. And MAP is able to provide that medicine to 25 million people around the world because the medicines are donated to MAP to pharma companies. Then we raise money and we provide it to our partners on the ground. And because of the impact and I know the value of medicines, that's how I got into public health. And we do some work in the US as well, but predominantly it's the people around the world that do not have access to basic health care that MAP and our partners provide to them. So it's really glad to be a part of this panel.
Thanks, Steve. One of the questions we were asked to answer was, how does having a disability affect our work in public health? And I was asked to specifically discuss the structural barriers, people's attitudes, et cetera. And I have to honestly say that this is actually, I've had several answers to this question. So I'm just going to tell you a little bit about my story, because I just realized that although I've worked with many of you for 20 years, I've never discussed my disability. And so I probably should start with that. So I was born with cerebral palsy. My twin and I were born prematurely. We were born 2 pounds, 3 ounces. And somewhere in the birthing process, or the first 30 days of my life in an incubator, my brain didn't have enough oxygen, and that's what caused the cerebral palsy. So, I learned to walk at age 4, and I'd have to say I never looked back. My disability, I was fortunate that having cerebral palsy wasn't very serious. I was able to do most things that everybody else was able to do. I'm very mobile. I can communicate, and so I was able to get an education and live my dreams. And so I started off with the Peace Corps because I wanted to see the world, and Peace Corps offered that opportunity. Somehow I was accepted, even though I went through medical review, and that's where my career started. And so moving forward, it was never ever done with the perspective of like, oh, I have cerebral palsy. Will I be able to do this? Will I not be able to do this? But I've always been sort of concerned that, with making a career change or, the interview process, well, how are they going to view me once they see that I don't exactly walk the way that everyone else does? But that was it. So I've never labeled myself as a person with disabilities. And when I started really thinking about what having a disability means for public health, it was through the eyes of other people. And this was with the Neglected Tropical Disease NGDO network. And this was when Wim van Brakel, who was with the Leprosy Relief Association, was advocating for a special work group on for people with disabilities and inclusion and equity. And he was making the case that, if people have the tools, if people have the obstacles removed, if they have the attitudes removed, then they're not disabled. And the example that he gave of tools is that, most people here, as we get older, will have to wear glasses. Well, if you don't have the glasses, you can't see the screen, you can't see the writing. So in a sense that you're disabled. You put your glasses back on, you're not disabled, you can see the screen. So that's what we mean by having the tools. But there are other obstacles like policies, people's attitudes, structural barriers. I mean, we all know about Mind the Gap when we go to the UK and we can't get on the subway. Walking around Atlanta is very difficult because there's no sidewalks. Or if the sidewalks are there, they're usually full of cracks and everything else. So that's what it's like for me with disability. On a personal level, I'm always concerned about how I'm going to be perceived. That's usually only lasts for a few minutes. But there's things that we can do in the public health sector to make our policies more open to people with disabilities and make our organizations more open to people with disabilities. So Steve Eichner, would you like to share how your disabilities informed your work in public health?
Sure, absolutely. And thank you for that. I've started using my disability as a tool to help educate people when I was very young. My first work in public health was actually public health education in a museum setting, science museum setting in particular, talking about health and health education and looking at genetic development. My particular disability, fibrous dysplasia ossificans progressiva, basically means my muscles turn into bone, and its cause is just one single letter off in the DNA strand. So being able to talk about that is kind of a real world example about how genetic changes impact our growth and our behaviors, and the impact of that on life has been something that has been kind of essential in my being since I was about 7 or 8 years old and started teaching in science museums when I was about 10 or 14. I've continued to use that experience, my life experience, to inform how I practice public health and public administration in my current role as health IT lead for the Texas Department of State Health Services, using it to inform things like how are we exchanging information about blood spot screening and the importance of protecting information and ensuring we're communicating properly so that providers have a full understanding of the data that's being exchanged and are using it in appropriate contexts so that a parent is not suddenly getting a piece of information about a disability or a genetic condition without that appropriate context. Similar things, looking at exchanging information about medications and using it to help provide additional context. Looking at COVID-19 response, again, I've been working with our senior leadership team on improving services for people with disabilities in accessing vaccine using my personal experience to inform policy decisions and making linkages between public health and community organizations to better serve individuals with disabilities. Across the board, we've been pretty successful in making some significant inroads.
Thank you for sharing that, Steve. So moving on, as global health professionals, we navigate several different types of spaces, and I think I may have skipped a question. No, sorry. As health professionals, we navigate different spaces. And so from Steve Sterling, could you please talk a little bit about perception and psychological impact of stereotypes?
Sure, I'll be happy to. First, let me say that coming from back then, it was developing country, South Korea, where I had polio. And by the way, in most places around the world, people believe that if you have any kind of disability, either at birth or because of disease or an accident, that you're being punished by God, and therefore you have to suffer through it, and then maybe next time around you'll be not disabled. So that's kind of the things that we were facing in growing up, and I'm sure all of us have experienced to a different level or degree of prejudice and just physical and verbal abuse. And I had many of that growing up in South Korea. And again, it's not just common to South Korea, it's many other places. It just happened to where I grew up. But even coming to the United States, while kids didn't pick on me when I came to the US, there's still stereotyping that goes on. And so I remember in college, I had a job at a internship at Ohio BP, and I was making really good money back in this would have been 1976. Some of you probably weren't born then, but $1,000 a month back then was really good money, and especially for a college intern. But I had somebody come up to me and say, "Hey," and they didn't know me, and say, "Oh, we got a great opportunity for you to work at this place." And I said, "Oh, good. I'm always looking for opportunities, right?" And they said, "Well," I said, "What kind of job is it?" "Oh, it's data entry. You handicap people are really good with your hands." And I said, "Okay, well, how much is it paid?" They said, "Oh, about 500." I said, "Well, I'm making double that, so no, thank you." But there's some stereotypical things that they think people with disabilities can do than others. And also there's some misbelief that if you hire a disabled person, they're going to be sick, they're not going to be reliable, they're not going to come to work, and all these other type of things, which is not true. And unfortunately, percent of people that are unemployed with disabilities is much higher than non-disabled people, unfortunately. And so we're just looking at different opportunities for all people to engage. And oftentimes, until they meet you physically, they don't know we're disabled. And obviously, at some point, when they see you, they know you have a disability. But hopefully, they see beyond that and give everybody a chance to show what they can contribute to the organization.
But I think just to add on to that really quickly, people may happen to have a disability, but they're still people and still have the same desires and interests as anybody else. Just because I happen to have a disability doesn't mean I don't want to have a house that's similar to other people in my general socioeconomic class and academic background experience. I like to go see movies, et cetera, et cetera. I like to be included and asked out and taken out to lunch with everybody else. It's just my disability may present some additional challenges in that space, but I'm still a person. And I expect to be treated in similar fashion, just as anyone would expect to be treated as a human being.
Absolutely. Thank you both, Steve, for sharing that. If I could share a little bit about my experience working internationally, what Steve said about discrimination, people with disabilities in low income countries, are marginalized. They're not expected to achieve much. Don't even, it could be said that, maybe some of the parents don't invest in their education because what could they possibly do? Or so I kind of hope that when people saw me as a Peace Corps volunteer, that maybe I changed people's minds about what a disabled person was capable of. Here was Kim Kaportz. She has, at the time, I had a bachelor's degree, and over time, with my Peace Corps, I was very successful. I was able to bring water and sanitation facilities to 35 communities in a district. And it's not because I was able to hammer a nail or shovel a hole in the ground. It was because I had skills in bringing partners together. So hopefully, by just being, then I was able to change some attitudes towards people, attitudes of people who may have, not given us a second thought if we were disabled. But I also have to say that working overseas, people ask me, well, how did you manage being a Peace Corps volunteer? There are a lot of obstacles, and people were, what I explained to people is that in my community, I think everybody's seen those huge gutters between the roads and the sidewalks, and I wasn't able to ever get to my house from the road to my sidewalk because of the huge gutter. But there was always somebody there to help me get over the gutter. I was never wanting for anyone to help me whenever I needed assistance. So in another sense, people in these communities seem to be hypersensitive to my needs as well. I think more hypersensitive than what I find in maybe traveling to UK or even within the United States. Thank you. So moving on, Cassandra, you are a person with dyslexia, and unlike, Steve Eichner and Steve Sterling and myself, people can't see your disability. Can you speak a little bit about that?
Sorry about that. Yeah, well, I'll give you a little bit about my life as a dyslexic. My school life, I was always struggling, and they didn't even know what dyslexia was. They just knew that I had some issue that they gave me a little extra help to get through school. But by the time I got to college, that's when I was diagnosed. As a dyslexic, your self-esteem is constantly fluctuating between highs and lows. In some areas you exceed beyond expectations, and in others you just really, really struggle. I spent most of my life hiding the fact that I was dyslexic, and I felt that people would judge me as less because of my learning disability. It was not until I went back to college and completed my master's that I finally shared that I was dyslexic more widely. The GSU MBA program showed that I was capable as any person, regardless of dyslexia. Oops, sorry. Somebody needs to mute. I completed my master's. I finally shared that I was dyslexic more widely. I worked a full-time job while I was getting my master's. And as you know, if you're a small team in global public health, that's hours. Plus, I did full-time school at my executive MBA program. And I completed the program in 18 months with a GPA of 3.72. It was empowering being surrounded by so many incredible professionals. I had people from all walks of life and business. And not only was I keeping up with them, I was doing better than some of them. So this made me realize that even though I have tendency to not, my spelling is atrocious, it does not make me less. But before that, I spent my life thinking I was less. Thank you.
Thanks, Cassandra. There are often times when we need to ask for a tool or accommodation that makes our work run more smoothly. What are some of the ways that you advocated for yourself in the workplace, and how did it go? And, Cassandra, I'm going to turn that question to you, and then I'm going to turn it over to Steve Eichner. So go ahead, Cassandra.
Okay. I'm sorry, Kim, what was that question?
So there are often times when we need to ask for a tool or accommodation that make our work to help us to do our work. What are some of the ways in which you've advocated for yourself to get those accommodations and tools, and how did it go?
Well, I know for me, I've always worked by myself. I've always accommodated myself. I've never reached out to an employer to ask me for help, because if I reached out to them, then I would have to flat out tell them I'm dyslexic. And then I worried that it would affect my ability for them to think that I could do my job. So I have back in college, I hate to date myself, but it's when Word Perfect came out. It was the previous, before Word, there was Word Perfect, and it had spell check. So I bought a brand new computer. My husband, we were very poor at the time. He spent all of our savings from when we were married, and we bought a computer. So I went back to school, armed for bear, with my computer. And plus, like I said, I was diagnosed as dyslexic then. So they gave me extra time, and I got to be able to be myself, to take my tests, and with an extended time. And it was incredible. I know that a lot of people with dyslexia do not take advantage. I was reading, before this, I was reading stats. They just don't use this in college. You have the ability to get extra time. You got ability to get help, but people do not want to be labeled as dyslexic. They, like me, are fearful that you will not be able to get a job if it gets out that you have a learning disability. So I know that at the task force, I've moved into with ITI, and oh my gosh, they're incredibly supportive of their staff. Carla has been amazing. She's my direct supervisor, but having a supportive group that looks at not just me as dyslexic, but looks at the entire team and sees how they can make their work-life balance better is amazing. Thank you.
Thanks, Cassandra. Steve Eichner, would you like to share your story about how you've advocated for yourself to get tools?
Sure, absolutely. Thank you for that. I've got a strong history of advocating for when I've got needs. I try to keep my needs minimalistic. I like being independent, but sometimes it's really necessary to get some help to do my work efficiently. And on occasion, that's included things like, getting a chair, not necessarily an overly special chair, but just if you want me to sit at a desk for 8 hours, hey, I need a desk that's good enough to sit at for 8 hours, that's, OSHA recommended and things like that. I've run into a few challenges in that space over time where management initially said, why do you need a new chair? Well, because the chair that I have has a wooden block underneath it instead of having four wheels. And, it would be helpful to have a newer chair that's capable of supporting regular kind of office activities. But I also find that non-structural asks and things done informally really are helpful, and most folks are willing to help. So small things like having a seat near the door reserved, so you're not having to go further around a room to get to an open seat if you've got a mobility challenge, or asking for meetings to be scheduled in conference rooms that are closer to your office rather than further away. Looking at things coming out of COVID-19, one of the huge benefits from my perspective has been the use of Zoom meetings or team meetings or video conferencing that has really enabled me to participate more actively in things where physically it was just challenging to get across campus to activities. And that's been really a wonderful thing, as well as enabling participation in events like this remotely, where traveling to conferences is a little challenging for people with significant mobility issues. And the use of telemedicine or teletechnologies, video conferencing, has really improved those supports. So I think really looking at having a good relationship with your supervisor is absolutely critical, and working with them to help navigate the system to get your needs met. I've never met a supervisor that's unwilling to help. Sometimes you just have to ask them, what's the best way to do it? Is it better off to do it as an accommodation request, or is it just a practical request that anybody in your situation, regardless of a physical or mental disability, might need? Like, hey, it's time for a new monitor, or time for a better computer. So figuring out the best way of asking is probably about half the challenge.
Thanks, Steve. Your stories made me think, when I was at the task force, I was at the task force for 20 years. And I don't think in the entire time I ever discussed the fact that I had cerebral palsy. And it was probably a missed opportunity to inform inform my colleagues about people with disabilities. And I just want to say thank you to the panel for organizing this, because I should have been telling my story for a long time. And that is to say, it helps to improve the culture of an organization to support people with disabilities. I had an obvious disability. I probably could have done more to advocate for myself, which in turn may have helped advocate for those people who maybe had disabilities that were unseen. So kudos to to the organizers of this panel. Okay.
I think to that end, just to kind of add on, I always strive and probably work diligently to be over-prepared for activities, really to set a good example, because while I'm not an official representative, as a percentage of some population that needs to be represented, but I want to do my darndest to make sure that I do represent people, informally in the best way possible, and come well prepared to say, hey, yeah, I may have a disability, but that's not who I am. Who I am is the health IT lead for the health department, and I'm prepared to talk about that and know the data standards and the policies that can provide good advice, regardless of the disability, and hopefully next time around, any evaluation that might be made on somebody that happens to have a disability really drops out of the equation in terms of making a hiring decision. That really my goal as a manager is to hire the best person for the position. And I would expect my manager to do the same thing. And happen to have a disability, okay, that's nice, but it really shouldn't be an active part of decision-making in that space. It's really about, from a government perspective, it's really about who's the most qualified and who's best able to serve in that position.
Yep, exactly. I mean, I don't want to speak for everybody on this panel, but I don't think any of us want to be identified because of our disability.
That's right. I was at an international meeting, and the people that invited me to their table, because they really wanted to invite me and say, hey, we want you to join our table. And so, and I didn't know them, and was another country outside of the US. And so they had my name tag as polio victim was my name tag. And so I said, well, that's interesting. I'm not a victim. That's where I started in life, but really does not define who you are or where our potential is. And so I think it's really this state of mind as to how people view you is also how you view yourself. And so, we're not victims. We're not, yes, it happened to us, but sometimes people think that we're in the situation because we're unfortunate, we're victimized, something bad happened to you, therefore you're disabled. So I think all of us here in this webinar know where we started doesn't define where we are going, where we are or where we're going. So I think it's important to have this discussion.
Thank you, Steve. So if we have the tools, as I mentioned, we're no longer disabled. What are some of the ways that we in the public health community at large can help ensure that we have an inclusive and productive work environment? So Steve Eichner, do you want to say a few comments about that?
Sure. Well, as I mentioned earlier, looking at the micro accommodations, really, in terms of looking at, hey, keeping an open door or keeping seats available on the door are important. But again, looking at participation really is key to help people be aware of what's out there and looking at participating in professional education is also important, both in terms of developing your own skills, but also serving as an example for others. And looking really at a goal of not just serving in public health, but really becoming a public health leader, if that's something of interest to you. Because if you do have a disability, you can sometimes bring that experience to bear and help develop new and better policies or practices. Not all the time, it may not be applicable to any particular situation, but like anything, our life experience informs decisions and what actions we take. And if we've got the life experience, we might as well take advantage of it.
Yeah, exactly. We all bring unique experience that maybe others don't have. One of the things that I would like to bring up is, some people may be wondering, what you can do to support us. And the thing is, if I just be aware that if, we talked about how sometimes we're afraid to talk about our disabilities or make it an issue because we don't want to be the thing that defines us. We're not victims, we're doing very well. Thank you very much. But sometimes we do need help. And if you see that we do need help, ask us how you can help us. One of the things that I was explaining to my neighbors is that if you want to see me fall flat on my face grab the door for me, because usually when I'm trying to open up the door, I'm putting all of my weight in opening that door, and I'm off balance while I'm opening the door, but I'm depending on the door for balance. So if you go and you grab the door for me, I'm completely off balance. I'm going to fall on my face. Those are sorts, or sometimes I have people, take my hand, and when I don't want them to take my hand, and then again that throws me off balance. So all that to say is, small things that you can do to help us are to first ask us if we need help, and then we can tell you exactly how we need you to help us, because we're when we need help, we're very, very vulnerable. So we need to be very specific. We need to be allowed to to be able to give you specific instructions about how to help us.
And I think just to add on to that, my particular disability or my particular issue in that space is that my muscles turn to bone. My body does not behave the way you might expect it to. My shoulders are frozen, so that if you were to think you were helping and reach out to take my arm, you could actually hurt me pretty easily. I can't react so that my arm is not going to move the way that you expect it to. And that puts both of us at potential risk. So if you think I need help, please ask. Or if you think anybody with a disability, please ask. And as Kim suggested, if there's a need, they're happy to say, hey, yeah, here's how you can help me, and I really appreciate it. I think probably an exception to that is that, yeah, if you see me coming and you know there's a heavy door right there, if you want to hold it open for me, I'm not going to complain.
Yeah.
I know that I've worked with Kim for years, and we are like the tag team duo in Europe, because I know exactly when to jump in and when to stay back. And I have seen her struggle with others that kind of join her dynamic and then want to coddle her, and she does not want to be coddled or need to be coddled. So it is.
And I should say, if you're the one coming right behind me, I'm not going to drop the door in your face.
Steve, would you like to share your experience?
Steve who?
Sterling.
Sterling, okay. I've been in international development for probably about now 18 years. And it's elevators are not commonplaces. You go outside of the US for the most part, even in Europe. Canada is really good, but most places outside of the US and Canada, there's stairs. And with crutches and leg braces, I can manage it. But if you have 5 flights of stairs, that's something different. Or you're in high elevation, you got to climb up 2 flights of stairs. That's something different as well. And so I think when you're in that kind of environment, it's most people aren't thinking because unless you're dealing with yourself, you're not thinking about, oh, is that going to be a little bit too hard to walk or whatnot, or how do we have this in some places like let's say India, instead of having a ramp, it's got to be gradual ramp, right? Literally, they take the stairs and they put a ramp on, and you could slide down them, but it's going to be tough to walk up because it's literally a 45-degree angle ramp, and that's got to be gradually done. So things like that are somewhat challenging. You just deal with it, or sometimes you're going to a place like Machu Picchu, and it's a wonderful place to visit, but with crutches, it's not a place to go because you have a lot of steps and uneven places. So, but it doesn't mean other people can go and enjoy it too. So sometimes just say, bring back the video, and I'll be happy to look at them and let other people go. So you just have to deal with the situation. And in most places, again, people want to help, but they're not familiar with what's involved unless they have somebody they know is physically challenged. But most people I find they're very good about those things, and you just have to adapt and be flexible.
And I think just to build on that a little bit, communicating up front, if you know something could be an obstacle, both how to overcome the obstacle, or if it's not really an issue, say, hey, no, it's not an issue. Yeah, I understand it could be a challenge, but I'm not worried about it. Like if I'm going to a conference as a presenter, there's usually a stage. Well, I don't necessarily want the organization to go to the extra effort to put a ramp in. That's not necessarily necessary as long as there's a lavalier mic or something I can use to present from the floor. I'll address it up front well before it so that there's no need for a scramble or a potential worry, oh, we didn't think about it up front, because I don't want to put an unnecessary burden on somebody else. And the last thing I want to do is do that at the last minute. If I can communicate up front and well in advance of what my needs might be, it makes it easier for everybody. And again, trying to think about what do I need, what's helpful, what's useful, what's achievable. Again, if I'm talking for 15 minutes as part of a conference, there doesn't need to be a ramp full-time at $1,000 or $2,000 expense. I'd rather the organization save the money. Now, if it's something where I would be more engaged for hours and hours of time, that might be a different story.
Thank you. So, Steve, Sterling, and Cassandra, how has being a person with a disability strengthened your perspective in your work? So, Steve Sterling first.
For me, what I try to do is put the other person at ease, because they don't know how to respond. How do you relate to someone with a physical disability? And so in the business world, as an example, there's certain things that I'm not going to be invited to. And this is in the corporate space where people play golf, they play tennis, they play pickup basketball. I can't do those things. And that's where you start developing relationships. You start having mentorship and whatnot. And I was not able to do that. At the same time, though, I would join where I could, where they would have workout places. So I would go down and work out with them and lift weights with them during lunchtime. So things that I can do to interact with them. I would watch, golf games, because I don't play, but if I can watch, then I can then have a conversation with them. And so that's how you can start figuring out, how do I relate with that person by doing something that they're interested in? And then how do you connect with that person? Because they might not know how do you connect with someone that's different than themselves. So it's really figuring out, okay, how do I go out of the way to be able to relate to this other person? So make them feel comfortable, develop a relationship, and then you get to know one another. Until you get to know one another, they're not going to be really asking you questions about your disability, what are your challenges, opportunities. But when you connect with them as a person, then you really, it's just a one-to-one relationship. And that's how you could start building a bond and growth. And it doesn't matter where you are, it really helps to do that.
Cassandra? You're on mute.
I've never really thought of dyslexia and how I think that part of the reason that I am so empathic and I really do feel what others feel, and I can really connect with people. And I think that's part of dyslexia, or maybe just part of my innate ability. I know that I was identified as kind of a servant leader, and I didn't even know what that was. And then I looked it up, and it's a person who is leading from the desires to serve others and for the betterment of others, and not just to attain power. And I found myself in my work that I reach out even to the smallest person and ask them, my first thing is, what can I do for you? Even though I need something from them, I say, what can I do for you? Is there any way I can help? And then I'll phrase the rest of my sentence about what we need to have done and why it's important. And I have more people doing stuff for me than you can imagine. And you're just thinking, what's this? And this is not something I'm doing on purpose. This is me. This is my personality. I want to help others. I want to do my best. I want to create great things. And having that passion and that wanting to do the best really draws people to you, and you get to accomplish great goals. And I've seen that with the NTD Supply Chain Forum. I know that my team within the forum, they bend over backwards to help me out. So it's super incredible. And I don't know that I would be in that same position if I didn't have this.
I just want to say that I'm in awe of, Cassandra, Steve Eichner, and Steve Sterling, because I think that I would have had a very difficult time answering that question is how has my disability strengthened me or my perspective of how I work. And I think that, like I said, I've always tried to ignore the fact and so I still don't think that I would be able to answer that question. So I'm just in awe of all three of you. I think it takes a lot of self-reflection um, and I'm in awe. So thank you for sharing that. So there's an issue of lack of participation in the workforce. For this panel, we were given the statistic that only 13% of companies in the US have reached the Department of Labor's target of 7% disability representation in the workforce. And, of course, we've talked during this panel discussion about how we can remove some of these barriers and take actions. And I was actually surprised to see these statistics because I wasn't surprised because I for one am one of those people that never checked the disability box because I was always kind of concerned, well, if I did check the disability box, then I wouldn't be hired. So I guess I'm not surprised by these statistics, but I also question them because I think they just might be a little bit higher than they actually are, especially when you have people that have unseen disabilities. And let's not forget that some disabilities are also people who are in a lot of pain, who actually have difficulty sitting for a very long period of time, et cetera. So I want to turn it over to Steve Eichner. And so if you could talk a little bit about the importance about how culture supports the needs of the employees or how they can do better to support the needs of employees.
Sure, thank you for that. I think part of it comes back to the self-advocacy component in terms of looking at participating in professional development opportunities. In our organization currently, there's support for professional development, but often you have to ask for it rather than supervisor assigning things that are not minimum necessary requirements. But that's something that you really have to self-advocate for and put it kind of in a separate box from, oh, I'm disabled, I need to make a reasonable accommodation request, and I also need professional development. Well, they're two separate elements. One should not take away from the other. I've gone to numerous conferences, both at the state and national level, and am accustomed, I guess, at this point, to being one of the only people there with an obvious physical challenge or physical disability. Now, there may be folks there with invisible disabilities, but you could tell from across the room that there's something different about me. And yeah, it feels a little weird, I will admit, that gee, I'm the only person here, and I look at that as a missed opportunity for other folks who may have disabilities that aren't going to these events, where they're learning about themselves and learning to improve their skills. And that's really unfortunate. But I also am concerned about the fact that people with disabilities aren't there as speakers and sharing their experience and their knowledge and their information that can help, again, improve public health practices. Coming back around to the work that I've done in COVID-19 vaccinations, I expect that may be of interest as we look at upcoming conferences next year, and I'm going to be putting in a couple of conference proposals. But I'd love for there to be other folks there making similar submit suggestions so that we can present cross-state examples of what's successful. And that's easier to do if people are already familiar with the idea of these national conferences. That it becomes, from a network perspective, I can reach out to folks and say, oh yeah, hey, saw you last year. Were you working on this? You went together and co-present at something next year. So it really comes around to that networking and support. And without that inter-organizational interaction, that's a missed opportunity. And there really isn't a standalone network or a separate network or a subcomponent that really lets us share information or facilitates sharing information between jurisdictions or between organizations. So that might be something to consider, something to come out of future discussions as to, hey, how, is there an opportunity, is there a need to support information sharing across a public health disabled employee world? Don't know.
I don't know either. But what your advice made me think of something. So when I first introduced myself, I mentioned the courtesy scholarship and how I had benefited in getting 2 degrees for almost free. And I was always astounded at the task force how more people didn't take advantage of those courtesy scholarships. So be your own advocate, be responsible for your career. Get those degrees. I mean, public health, when we talk about the culture, I mean, public health more than anything else, I think any other field probably values those degrees. Number 2, find a mentor. And number 3, take advantage of opportunities to attend meetings and conferences. And if you don't feel like you're getting those opportunities, talk to your supervisor, or again, find that mentor or someone who could advocate for you. Cassandra, can you share how the organization, how the task force can make you feel more comfortable, or have helped you to feel comfortable about your disability?
Well, I know a lot with dyslexia. I identify with the people who are coming to work with us that do not have English as their first language. They have many of the same struggles that I have with writing and getting your voice heard on paper. I'm pretty good in person. So there are wonderful tools out there that can be incredibly helpful, like Grammarly. Of course, WordPerfect does great things. I mean, just Word with the spell checker, and also has grammar check, but Grammarly really is useful. And text to speech. I know that it's using the tools that are available out there. I could see the organization that if they really wanted to help with the unknown disabilities that just people are not comfortable with sharing, maybe have tools available to everyone within the task force so that you can't be singled out for your use of it. I mean, I think Grammarly was one of the best programs, and I know that a lot of people really enjoy being able to use that, and it really helps advance their writing and solves a lot of problems. Okay.
Thanks, everybody. And thanks, everybody, for the comments that you put in the chat. They're very encouraging, and I'm glad that you found the discussion to be eye-opening and inspirational. And just to the other colleagues or other people who are in the audience, please take time to read the chat comments. So we're right on time. So we're going to go to Q&A, question and answer. So if you have a question for any member of the panel, please put your question in the chat. We have our colleagues from the task force who are monitoring the chat, and they'll tell us what the questions are. So we'll give you.
While they're queuing up, just one last word on the advocacy piece. I think advocacy, whether you've got a disability or not, really is important. I cannot honestly tell you whether I leveraged my self-advocacy skills based on my physical challenges or something else, but not being afraid to speak out has not really been an issue for me. And one of the things that I did, not necessarily intentionally, but when I started with the department, I rode up the elevator every morning, kind of coincidentally, by one of the associate commissioners. And we got to chatting and developed a good working relationship. And I guess perhaps because I've got a physical different posture, stood out in a crowd, he remembered me, but then when he was looking for advice on something that he knew I knew about, came to me looking for that advice, and we developed a good relationship. And he served as a mentor and really helped me early on in my work with the department and helped get me where I am today, again, within that department. So I serve as a member of our senior leadership staff. I'm not senior leadership, but I am part of the staff that directly supports them. And some of that is really related to my early work, kind of advocating for myself and speaking up.
Thank you for sharing that. So we have a couple of questions, but only a couple of questions. So if people are a little bit concerned about posing their question because this is being recorded, there is an opportunity to pose your question as anonymous. So that is one option that you have. So while you're thinking about your questions, I'm just curious to know, and you could put this in the chat, have you had any aha moments? I mean, some of you have known me for 20 years, over 20 years. Some of you have known Cassandra and both Steves for a while. Just curious to know what your aha moments are regarding listening to our stories about disabilities. Because like I said, this is the first time that I've ever publicly shared my story about having cerebral palsy and what my experience is. So, what did you learn? And, if I get the opportunity to tell my story again, or if the others get the opportunity to tell their stories again, what should we share? So one of the questions I have here, it's a long one. So, and this is to me or Steve Eichner. In my mind, one of the issues is mainstreaming of disability issues in all public health programs. Just like gender has been mainstreamed many years ago. The starting point could be based on endorsement by countries of the UNCRPD, I'm not sure what that is, to have disaggregated data on the range of, those are the development goals, indicators. Integrate equity throughout all the goal targets and indicators. Disability is one of the cross-cutting issues. In this way, countries comply with the international agendas on disability issues. And then one of the policies make program managers. What do you think of this, and how do you know if there is any movement on this? Well, maybe Steve Eichner can talk more about this than I can, but honestly, I don't, I honestly have not paid attention to what the international policies are for people with disabilities. I think after this conversation, I will maybe dig into that more often. But going back to when Wim van Brakel talked about inclusion of people with disabilities in neglected tropical diseases, because you have people who are disabled from leprosy, people who are disabled from onchocerciasis or for trachoma. A lot of what we do in public health does not address disabilities. I mean, we focus more on getting the pill into the child's mouth, or we focus on the vaccination, and we talk about preventing the disease, but not about what to do after the person is affected by the disease. So I think that is a shortcoming of public health. And this is coming from a person who hasn't thought about it all that much. But maybe instead of talking about the United Nations, because we all know it's like sausage. I mean, it doesn't look very good when policy comes out at the very end. But I would maybe put it to the Task Force for Global Health. You have several different kinds of programs that affect people in the long term to prevent disabilities. Are there programs that you can do to support people with disabilities, especially from trachoma or lymphatic filariasis, onchocerciasis, polio, et cetera? So maybe something that the task force wants to think about.
Well, Kim, I think it's a twofold piece. I'm not sure that it's focused on problems that are exclusive to a disability, but looking at how do we, as public health practitioners, program designers and the like, make design programs that are inclusive of individuals with disabilities. For example, looking at some of the ongoing concerns about health equity and looking at transportation and access. Well, if we're doing things, which is a wonderful thing, to improve access or bus routes to get people to where they need to be for services or access to food, let's take the extra step to make sure that that transportation is accessible to people with disabilities. I'm not saying it has to have electronic lifts. Hey, I'm a strong proponent of pull-out ramps on buses that don't require a lot of, overly mechanical expertise or fail, that need electronics to work. Pull it out, make it work, make sure it's the right angle so that it's workable. But I think that's an important characteristic that quite frequently we overlook terribly often. So I think it's not necessarily a separate program focused on individuals with disabilities, but how are we designing programs in a way that are accessible to everybody, regardless of their ability, whether it be mobility or learning or other challenge.
Right. Can that person get to the place where they need to get the shot or need to get the tablet to prevent intestinal worms or
Right, exactly.
exactly. So it's a full spectrum. The next question, and this is to Steve Sterling and Cassandra, and the question is, you touched on this a little, but what are your thoughts on specific things that can be done to create an inclusive culture of or advocacy in the workplace for persons with disabilities? So maybe Steve Sterling, if you could start, are there more ways that an organization's culture can be improved?
I think that, it's with anything awareness, because until you are aware of something, you don't know how to interrelate with those that are different than you. And it's oftentimes just understanding, and most people with disabilities, you don't need a lot of different adaptations for them to work there. And so I think it's just giving them a chance, giving us a chance. And I think what you'll find is most people with disabilities will work twice as hard because you've had to have done that all your life. So you're going to be doing twice as much just to make sure that you're going to be good enough. And so it's just to welcome them, and for the HR and the hiring managers, give people with disability a chance at the job. You want to hire the best person, but given all things are equal, give that person a chance to be hired. And so it's across all categories. So it's not just public health. It's across, if you look at corporations to governmental agencies, nonprofits, universities, everywhere, you don't see that many people with disabilities working. And if you look at the high level incidence level, is about roughly 10% of people in the world are disabled, and yet there is not 10% of people with disabilities working at organizations. So it's really just to give people a chance, and then you evaluate on the outcome. We don't want any special treatment. We want equal treatment, and really it's about how do you perform at the level that's good for the organization, and then also about the team, because you work with people in teams, and that's also very important. So how do you do that? And it's up to us to how do we fit in. It's not, it goes both ways. You can't just say you got to fit into my world, because the world is not that way. So you have to figure out how do we fit in to that world as much as we can, and then ask for special accommodation when we need it. By the way, having doors that are easy to open, that's good for everybody. We're all getting older. And so if the doors are really hard to open, it's not good for anybody carrying a box and you try to open a door. I'm all for automatic door openers, by the way. But aside from that, you can make things that's easy for everyone, not just for people with disabilities.
Right. If you help people with disabilities, you help everybody.
That's right.
Everybody sprains their ankles once in a while.
From my executive MBA, from that program, I learned that the strongest team is a team that's diverse. If you have a strong mix of people from all walks of life, and you make them comfortable and trust you, then you go into a meeting and everyone's confident enough to speak up and share their opinions. And when you've got a team of 18 jumping in and saying, well, this would really work well, and no one else had thought of it, all of a sudden you've solved a problem because your team is comfortable, even though they think it might be a little stupid, but they're still got the confidence to go, what if we do this? And everybody's like, I think that'll work. And they give it a try. And then it fails, but that's not a big deal because you try something else. So I guess the ability to be free, to be able to express yourself in a team can make that team even stronger, and you can get even more work done.
Thanks, Cassandra. I like this next question, and it's posed to Steve Eichner. We put on a lot of workshops. Yes, you do. What questions can we include in sign up or registrations that will make people comfortable in sharing what they need? Whether that be transcription service, interpreters, a seat close to the door. Do we ask, are there any accommodations needed, or are there better ways to phrase that? And that's a good question, because I remember, organizing meetings for the task force, we also always said, do you have any dietary restrictions? But we never, ever asked a question about, well, what special accommodations do you need? And back to Steve's point, I mean, I think a lot of people were with me when I was at the NNN meeting in Paris, and I couldn't get up on the stage because there was no railing. So, but Steve, the question was to you.
It's a great question, but
Yeah.
I guess my immediate reply would be, what makes it special?
Okay.
That to the point of having universal design, universal access, it is a goal that we're not at yet. But in terms of looking at asking the questions about, hey, what can we do to help? Putting it in that context, a statement. We want to make sure that we're meeting your needs to fully participate in this activity. What tools do you need from us? Or what resources do you need from us to support you in that participation? And if you've got questions, a phone number to call, because sometimes it's hard to put things in words or understand what the current environment really is in terms of that plan. Hey, are we doing things in 22 different buildings, or, football fields between spaces, or is everything in a more intimate space where I don't need to worry as much about hauling long distances? So that it can scale up, and most of the time, you're not going to get very many questions at all. Even thinking about HIMSS, which is a health information management organization that has 50,000 people going to their conference. I actually asked a question. They had 35 questions about accessibility last year. So we're talking about a really small number of questions that may actually come up. I think the other thing that organizations should do is have kind of a plan for meeting some of the harder things that you may not think about in terms of being able to address, like access to sign language interpreters. If you had a need for one, how would you go about finding one or hiring one in that space? Do you have an existing contract in place for support? Do you have a list of individuals that you can contract with to meet that need? So that you're not caught in a last minute challenge of, oh, okay, someone asked for this 3 days ago. I don't even know where to start. Not that you necessarily have to have an interpreter or resource in place, but knowing how you might meet that need is important. Or looking at things like presentation materials. Often folks with visual limitations may want large format prints or large format materials of handouts. Having a conversation with them in terms of what meets their need best might be an electronic copy so that they can use their set of electronic tools to blow it up rather than looking at having a paper copy. So again, coming out of that conversation really is helpful.
Thank you. Thanks. Those are all really good points and good recommendations. And thanks again to the person who asked that question. Hopefully task force will start doing that. They do put on a lot of meetings, and maybe more organizations will take the task force's lead. Steve Sterling, this question is for you. There's much to be done to increase awareness and action among organizations in increasing workforce representation. Are there specific organizations that we can support in advocacy for this issue? So do you know of any organizations that?
There's an organization in Oregon. It's called International People with Disabilities, and they try to help, particularly internationally, because that's where the biggest gap is in terms of access and just having even access to education. That's one of the toughest areas, because if you can't get educated, then you really don't have a chance in life. And unlike in the United States, where by law you have to provide access, equal access for education, in developed countries, that's not the case. And by the way, in developing countries, if you have a limp, they'll say you can't go to school because you're bad luck in that public school, and other kids don't want to be around you. So education is probably the biggest area. And if you can educate a child with a disability, at least you're giving them a chance to have some kind of a trade and make a living, because in most places around the world, if you're not making a living, you don't have value. You know, animals have value because of what the animal represents. But if you, as a disabled person, if you can't work, then it's more of a detriment. So I believe the education, if you can somehow educate that child, and again, the developing countries, it's the biggest opportunity. But even the U.S., if you look at the higher levels of education, do you see that many people beyond college and graduate school and whatnot? Because again, that's where I believe we'll have the greatest chance of impact if you provide the education for people with disabilities.
I think to build on that, thinking about things like the funding that ONC recently released for public health workforce training, and leveraging opportunities like that to ensure or facilitate, inclusive training across the board would be a wonderful piece. And looking at scholarship or benefit for registering for conferences and participation, again, would be a wonderful thing. Another potential opportunity would be working with governors' committees on people with disabilities. I think almost every state, if not every state, has that type of organization, reachable through the National Governors Association or through governor's offices directly, in terms of looking at coordinating or reaching out to those types of services. Department of Labor and their work around Disability Employment Awareness Month might be another opportunity for promotion.
Thank you, Steve.
And I also agree with Steve Sterling about education. My grandfather, from my earliest memory, is him telling me that I had to go to college. So I was told I had to go to college, and I went to college and I paved my own way. So I think that without education, you're lost, especially if you have a disability. You have to go to college.
And I guess backing that up, my particular condition has a fairly strong support organization. And one of the things, we actually just had a family gathering a couple of weeks ago, virtual, one of the things that I've been a strong advocate for and presented on multiple times and provided guidance to lots of other folks with the condition is to focus on education and develop intellectual skills and capacity to work based on your brain, because my condition happens to be progressive. So really leveraging that education becomes a way to interact with society and achieve and maintain independence. So that's another opportunity to advocate again.
Thank you. Cassandra, can you say a little bit more about the fact that, all this current or most services for the people with dyslexia target children, but there are very few resources available for adults?
Yeah, well, if you're older, you're my age or Kim's age, there is very little, we're the same age, there are very little resources out there for adults with dyslexia. So you really need to get on top of it when you are a child. So if you have a child that has a learning disability, but you're fearful that they may be labeled, you have to get them help. There are tons of things online that you can use and you can help train the brain to beat this. But if you don't start young, they're going to be struggling their whole lives. And the fact that there are so much opportunity out there for a parent that cares enough, or an aunt or a sister, or anyone in society that finds a child that is struggling. Right now, I mentor to anyone I can find that's dyslexic because they think they're less, they think they're stupid. And then I point out all the strengths of a dyslexic brain, and it just changes their world. They light up, they start thinking about there is something out there for me. And it has become, one of my struggles is I want to reach out to as many people as possible and say, I can do it, anyone can do it.
Thank you. And I just want to point out that I think Momeen, she put in the chat that according to UNESCO, 90% of children with disabilities in developing countries do not attend school. So again, the theme of education and how important education is. I just want to thanks for everyone who shared their aha moments. Rachel and Danielle shared that their aha moment was to ask first before helping. Jasmine said that every person and every disability is different and flexibility is key. And yes, I think that the one thing that all of us are concerned about is that we're going to be put into a box and have an be identified as a person with just cerebral palsy, and the picture of a person with cerebral palsy is someone who is in a wheelchair. Or someone who acts drunk. Lynn shared 3 takeaways or 3 ahas. Don't assume that someone needs or wants, ask and they will tell you. Make tools available for all. That makes it easy for anyone who wants to use them. And number 3, our limitations are very often our strengths and our superpowers. And yes, Lynn, our limitations are often our superpowers. And Sarah, making tools and services available to everyone and not just targeting those with disabilities. Exactly. You help one, you help all. We're coming to the end of the session, but I want to give everybody an opportunity to give one final piece of advice. So what is the one piece of advice that you would give to all of our colleagues, young students with disabilities who want to work in public health? So I'll go in order of Cassandra first.
Well, first, get all the help you can get. If there don't think that you're getting a crutch. You're not getting a crutch. You're becoming equal with everyone else in your cohort. So it's really important that you take advantage of all the tools that are available to you, and there are tons in college for both disabled people and mental disorders as well. So take advantage of this. Reach out to people that have dyslexia or have a struggle. I know people that are struggling with ADD, and it's their superpower. Once they get the drugs to balance the disorder, and they get the tools that are available in school, they're just incredible. So don't think of your disability as a weakness. Think of it as a strength and how it makes you be able to accomplish anything you want in this world. And get a mentor. It's good to have one.
Thanks, Cassandra. Steve Eichner?
I think engaging with people and developing good communication skills is absolutely key. You can leverage the communication skills both to self-advocate as well as using the communication skills in the practice of public health or whatever career you seek. And that really will help you in advancing your career and achieving your goals.
Thank you. Steve Sterling?
Thanks for everyone who's participating on this webinar, and really encourage the young people who are going into public health. It's a very noble profession. It's really a profession that thinks of others because of the importance of health is paramount to everyone, especially nowadays with the coronavirus. Everybody's always thinking about health now. And particularly those who are outside of the US who do not have access to good health care, public health is so important. So I really encourage you to follow your passion. It's not gonna be easy. And public health helps everyone, doesn't matter if you're disabled or not disabled. And so really applaud you for your pathway to study and work hard, because you will make a difference in people's lives when you define your path in public health. And there are many giants in this space, and Dr. Bill Fagey is one, and you may not come up with the eradicating smallpox, but in your small way, you're going to make a big difference. So please continue your good work in public health, and you will help somebody make a difference in their life.
Thank you, Steve Sterling. And I think my final advice to the group, and and I'm going to be stealing this from Steve Sterling or Steve Eichner, who mentioned this in a previous discussion. But if you think you can do it, then you can do it. Don't let your disability get in your way. So I don't know if everybody can see the chat, but there is, I think someone just put in the chat the link to the PowerPoint presentation and to the videos and recaps. And if anybody has a question that they would like to ask and they didn't get a chance to ask the question during the discussion, they can send their question to askhr@taskforce.org. So if you see those, I'm pretty sure everybody can see those links in the chat. So thank you, everybody. This has been an excellent discussion. Thank you so much to the panelists. And thank you to all of you for putting your encouraging comments in the discussion and your thoughtful questions. The Faces of Global Health is hosted by the Council for Opportunity, Diversity, and Equity, also known as CODE. So on behalf of CODE, I would like to thank everyone and our panelists for being a part of today's discussion. As I mentioned, if there are any questions, you didn't get a chance to submit them, you can send them to askhr@taskforce.org. And to learn more about the Task Force for Global Health and Opportunities, please visit taskforce.org. And I think you will also be able to find a recording of today's session on taskforce.org. And here you see a PowerPoint presentation with additional links for more information. With that, again, thank you, everybody. Thank you to the panelists. It's been wonderful to be part of the task force again, even for a couple hours. And I've really enjoyed seeing some of the comments from my colleagues. So thank you, everybody. Take care.
Thank you for having us.
Thank you.
Thank you.
Thank you very much.
Enjoyed being on the panel.
Yeah.
Thanks, guys.
Bye. Thank you, Kim.
Bye. Thank you.